Submental liposuction, or liposuction of the neck, chin, jawline, refers to a liposuction treatment that essentially treats everything from one mandibular border all the way around to the other and down along your neck. So that is what is treated with submental liposuction. How it's done is, in most people, I need to make a tiny little incision under your chin, as well as a little incision behind each earlobe. And through those access points, I'll infuse a bunch of numbing medicine or tumescent solution. What the tumescent solution does is it mixes with your fat cells to reduce any pain as well as minimize bruising. Then the tissue is all broken up with a special liposuction cannula, which discontinuously undermines and loosens up that neck skin, which is very important in achieving a great result after this procedure. And then the next step is to suck out the loose fat cells with a different cannula on suction. And then the next step after that is to use a different cannula to smooth out the fat cells that are left. So we don't want to remove all the fat cells, because then you'll have contour irregularities and adhesions. So at the very end, I use a separate cannula that sort of rakes the sand trap and smooths everything out. And then after that, you basically go into recovery mode, and I have another video that explains the recovery after submental liposuction or neck liposuction. This is most commonly performed under numbing medicine. You do not need to go to sleep for this. If you're going to sleep for another reason, we can absolutely do it under general anesthesia or IV sedation. But if you do not want to go to sleep for this procedure, you do not have to. Most people do it under local anesthesia only. Some key points with submental or neck liposuction are that, in my opinion, it's very important to do wide discontinuous undermining with the cannulas, because I want that whole sheet of skin to be able to redistribute and lay flat. In other words, I don't want to just suck out fat where there's fat and not allow the skin to redrape, because what's going to happen is, even though you'll have less fat in that area, you might end up with some bunched up redundant skin there, which would go away if we discontinuously undermine and free up that sheet of skin so it can redrape and lay flat. On that same note, it's important after submental liposuction to not sleep like this. So don't sleep with a bunch of pillows that causes all that skin to bunch up. I want you to sleep with no pillows, and if you really want to do it right, put some rolled up towels or something under your shoulders so you sleep like this. Sleeping like this will allow your skin to redrape and minimize any neck wrinkles that you may develop after liposuction of your submental region. So in summary, the goal of submental liposuction is to treat and remove the unwanted fat from underneath the chin and along the jawline and neck. And the secondary goal of neck liposuction is to break up that skin so that it can redistribute and tighten up once that volume of fat has been removed. To learn more, check out our website, where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page, and our SpeakPipe is located there. Thanks for listening.